Hi everyone! I'm Sharies Argel, your student nurse, and I am studying at Northern Christian College. So today, I am going to perform a nursing head-to-toe assessment. In doing head-to-toe assessment, there are three sequences that we will need to follow on how to assess on each system, which is to inspect, palpate, percuss, and auscultate. But in the abdomen part, we are going to inspect, auscultate, percuss, and palpate. So what I'm going to do is to assess from the hair of the head all the way down to the toes. So without further ado, let's get started. So hello, I'm Sharies Argel and I will be your nurse today. And I need to do a head-to-toe assessment. Is that okay with you?
Yes.
So, can you tell me your first and last name for me?
My first name is John Paul and my second name is Aliga.
Date of birth.
September 25, 2002.
So, do you want me to call you Mr. Paul or Mr. Aliga?
No, I'm okay with Paul.
So, Paul, can you tell me what we're going to do right now?
I think we are going to do head-to-toe assessment.
So, here's another question. Who is the President of the Philippines?
President Rodrigo Roa Duterte.
Okay, so as you can see, he is alert and he answered all those questions correctly. And we collect vital signs such as heart rate, blood pressure, temperature, respiratory rate, and the patient's pain rating. So Paul, are you having any pain scale 0 to 10, which means 0 is no pain and 10 is the worst pain you've ever had?
No, I don't have any pain, so that means it's 0.
Okay. So we are going to inspect first the head and we are looking at the skin color and to make sure that the head is the same size as how it should be for the body. And we're making sure that the face is symmetrical and no drooping in one side. And also, we're looking at the eyes and ears, whether they are at the same level. Well, as far as I can see, it is all okay. And we will also look at the facial expression and test the cranial nerve 7, which is the facial nerve. So can you close your eyes tightly for me and open them up? Now smile for me. Frown. And pop out your cheeks. Okay, so the cranial nerve is intact. Next is we're going to palpate the head or the cranium. So what we're doing is we're feeling for any masses indications. And we're also looking for any breakdown. And we must also look inside the hair, make sure there is no any infestations like lice or alopecia. And yeah, everything looks good. So what I'm gonna have you to do, Paul, is I'm gonna have you clench your teeth, like bite down for me. And I'm gonna feel them with sternum muscle. And feel the temporal muscle. And now, what I'm going to do to also test that nerve is to open your mouth against resistance. Okay, and he can do that. We're going to palpate the sinuses. So I'm going to put pressure on these two sinuses right here. And you tell me if you feel any pain, okay?
Okay.
So the maxillary. You feel any pain? In the frontal. Do you feel any pain?
None.
So okay. Next, we're going to inspect the eyes. So we shouldn't see any eyelid swelling. We shouldn't see that the sclera is white. And the jaundice shouldn't be color yellow. The conjunctiva, when you pull down the lower lid, It should be nice and pink. And look at the eyes. It is equal and there is no stabby or anisocoria. Next, what we're going to do is to assess some cranial nerves, which is cranial nerve 3, the oculomotor, cranial nerve 4, which is trochlear, and cranial nerve 6, which is the abducens. So the first one, what we're gonna do is looking for any involuntary shaking of the eye called nystagmus. So what we're gonna do is to hold it about 12 to 14 inches away from the patient's nose. Next, we're going to see how reactive the pupils are to light and to do that we're gonna dim the lights a little bit and the patient should stare off at the distance that helps dilate those pupils. And if both of his eyes can constrict. Next, we're going to check for accommodation. We're gonna have him stare up at a distant object that helps dilate the pupils. And we're just going to slowly move it inward to the nose. Next, we're gonna move on to the ears. So we inspect the ears. We look on the outside of the ear if there is any abnormalities or any redness. Paul, are you having any pain in your ears? So we're just going to move it around. So tell me, Paul, if you have any tenderness or any abnormal masses or lesions. Okay? And then we're gonna palpate the massive process, which is the big hump behind the ear. And we're looking if there is a swollen or any redness. So Paul, do you feel any tenderness? Okay. One more thing with the ear, we're gonna test cranial nerve 8, which is the vestibulocochlear. So what I'm gonna do is to whisper 2 words on the other side, and he need to tell me what I said.
No. Apple banana.
Okay, so that nerve is intact. Next, we're gonna move on to the nose. We're gonna sure its midline on the face, which is we're going to look at the septum if it is deviated. So Paul, are you having any dryness or any tenderness in your nose?
No.
So okay. Then I'm gonna check the patency of the nose. So Paul, can you occlude one side your nostril and breath to the other side and vice versa? Okay, on the other side. Okay, it looks good and patent. Next is I'm gonna look at each side of your nose for any dryness, redness, or any like polyps, okay?
Okay.
Everything looks good and I don't see any polyps. And then we're going to test the cranial nerve 1, which is the olfactory nerve, the sense of the smell. So Paul, what I'm gonna have you to do is I'm gonna have you close your eyes and I want to put something in front of your nose and smell. And then tell me what you smell, okay? So we're gonna need to put
Baby cologne.
and this is a baby cologne. So the cranial nerve is intact. Next is we're going to move on to the mouth. So let's test the cranial nerve 11, which is the hypoglossal nerve. So Paul, what I'm going to have you to do is to stick out your tongue and move it side to side. Okay, the cranial nerve is intact. Next, is we're going to inspect inside of your mouth. So Paul, can you open your mouth? And I'm going to check inside of your chin. And I don't see any dryness or any lesions. And can you lift up your tongue for me? And I don't see anything also. And your ovula, it is nice and midline. Next is I'm going to test cranial nerve line, which is the glossopharyngeal. So what I'm going to have you to do is to say up to check if your ovula is going to move up. So say up. So it is moving. And then I'm going to check the gag reflex. So I'm just going to poke a little bit to elicit a gag reply, okay? So open your mouth. And cranial nerve 10, the vagus is intact because he's able to talk to me without harshness and he's able to swallow. We're going to, wait. Then we're going to place him at a 45-degree angle. So Paul, can you turn your head to the side? And as you can see, there is no distinction of the vein. Then what we're gonna do is to check the cranial nerve 11, which is the accessory nerve. So Paul, what I'm gonna have you do is to move your head side to side, up and down, and then shrug. Okay, the cranial nerve is intact. Then we're going to place him at a 45-degree angle. So Paul, can you turn your head to the side? And as you can see, there is no distinction of the vein. Next is we're gonna palpate the trachea to confirm if it is midline. Do you feel any tenderness? Okay. Next part that we are going to do is to palpate the lymph nodes. And we're gonna start at the preauricular, which is the right in front of the ears. And then to the back of the ears, the postauricular, and then to the occipital, the parotid, the jugularly gastric, and then to the submandibular, and to the submental, and to the superficial cervical, and then to the deep cervical chain, and to the posterior cervical, and to the supraclavicular. So there's no any tenderness. Now, let's move to the upper extremity. So what I am going to do is to inspect the extremities and look for any lesions or redness. What we're gonna do is to palpate his pulse, his facial artery, and there are 2 plus and there are equal. Next, to check the capillary, so we just press the nail bed and see how fast it conducts. So it is less than 2 seconds. Next is to check the skin target by just pinching the skin and see how fast it is goes back. And we're just gonna look at the range of the motion of the fingers. And I can see any abnormalities. And next is to move the elbow. Do you feel any tenderness? Okay. Another thing that I am gonna do to upper extremity is to check for any drip. And what you will do is to hold out your arms and close your eyes. About 10 seconds. Okay, so as you can see, there is no any drip happens. Next, we're moving to the chest, and we're going to inspect the chest and look for any abnormalities. Next, rotating posteriorly. Inhale, exhale. Inhale, exhale. Inhale, exhale. Next, we're going to assess the abdomen. Remember that we're gonna do inspection, auscultation, and then palpation. So what I'm going to do is to inspect the abdomen. So first, I want to ask you, Paul, are you having any stomach issues at all?
No.
And when was your last bowel movement?
Yesterday evening.
And how are you urinating? Do you have any pain or any discharge?
No.
So now, let's start to listen the bowel sounds in the right lower quadrant and move to the right upper quadrant and to the left upper quadrant and lastly to the left lower quadrant. Okay, so the bowel sounds are normal. Next, we're going to assess the lower extremities. So as far as I can see, there is no any abnormalities, any swelling or redness. And also, the toenails is really good. There is no fungus or any bad ingrowth. So now, we're going to palpate the popliteal pulses. So, they are equal bilaterally. And I am going to push his tibia firmly. So everything's good. There is no any edema. Now we're gonna palpate on the feet. We're gonna feel on the posterior tibial. And it is really good. Next, the dorsal pedis. And it is also looks good. Next, the capillary. So as you can see, it goes back less than 2 seconds. Next, I want you to raise your legs against resistance. Good job. Next, we're gonna check the Babinski reflex using the reflex hammer. So what we're gonna do is to take it up through the ball of the foot and move it. So, the other one. So yeah, it curls up and it is normal. So that is how we assess an head-to-toe assessment. So I'm Sharies Argel.
I'm John Polaliga.
So that's all. Thank you. See you on my next video.